Hey guys, Rashmi here, a student of GMC Nagpur, and today I'm gonna address the topic median nerve under four headings: root value, course, branches, and lastly the clinical aspect. So, root value of median nerve is ventral rami of C5 to C8 and T1 spinal segments. Talking of its course, median nerve is formed by two roots: the medial root from the medial cord of brachial plexus and the lateral root from lateral cord of brachial plexus. The medial root crosses the axillary artery to combine with the lateral root where it forms the median nerve that lies and runs along the lateral side of the axillary artery till the middle of the arm, where this nerve will cross the axillary artery in its front to reach its medial side from where it enters the cubital fossa. In the cubital fossa being the medialmost component, it will leave this fossa by passing in between the two heads of pronator teres. So this is the humeral head that is cut down and this is the ulnar head, in between of which the median nerve passes to enters the forearm. In forearm, the nerve lies in the center and will pass deep to the flexor digitorum superficialis muscle on the substance of flexor digitorum profundus. So, the nerve being adhered to the deep surface of superficialis muscle, it leaves the muscle along its lateral border and lastly placed deep and lateral to the palmaris longus tendon. The nerve will enter the hand by passing deep to flexor retinaculum. Here the nerve being medial to the thenar eminence ends by giving few digital branches and some muscular branches. Talking of the branches that is given by this nerve, so median nerve is the nerve of flexor compartment of forearm. Now we have superficial and deep sets of muscle in the front of the forearm. As we studied the course of this nerve, accordingly we will see which branches are given by this nerve. In the lower part of the arm, it gives one branch to pronator teres. Then in the cubital fossa, it gives three branches for the flexors of forearm that include flexor carpi radialis, palmaris longus and flexor digitorum superficialis. Now, in the forearm, this nerve gives one branch that is anterior interosseous nerve that gives supply to the deep muscles of forearm that include FTP, that is flexor digitorum profundus. So here only lateral part of FTP is supplied by this nerve, as this muscle is hybrid muscle supplied by two nerves, median and the ulnar. So only lateral half of FTP is supplied by the median nerve. Nextly, we have FPL, that is flexor pollicis longus, and then pronator quadratus. Coming to hand, we have total 20 intrinsic muscles of hand, and out of these only 5 are supplied by this nerve. So first let's see which are those 20 intrinsic muscles of hand, counting with 4 palmar interossei. These are the unipinnate muscles, then 4 dorsal interossei that are bipinnate muscles, then 4 lumbricals. Here first and second lumbricals are unipinnate and third and fourth are bipinnate. Then we have 3 thenar muscles. So here you can see this is the thenar eminence that is formed by 3 muscles, that is abductor pollicis brevis, flexor pollicis brevis and opponens pollicis. And this is the hypothenar eminence that is formed by 4 hypothenar muscles that include abductor digiti minimi, flexor digiti minimi, opponens digiti minimi and palmaris brevis. Lastly, we have one adductor of thumb, that is adductor pollicis. Now, out of these 5 muscles that are supplied by median nerve includes the 3 thenar muscles, that is abductor and flexor pollicis brevis and opponens pollicis, and first and second lumbricals. Now, coming to the cutaneous branches, so one palmar cutaneous branch is given by this nerve in the forearm that supplies the lateral 2/3 of the palm, and then the digital cutaneous branches give supply to the lateral 3½ digits. Also, on the dorsum of the hand, skin over the distal phalanges of lateral 3½ digits, including their nail beds, is also supplied by this nerve. Now, as you can see, most of the area of hand, the sensory supply is by median nerve. Hence, this nerve is also known as eye of the hand. Coming to the clinical aspect. Now, if the median nerve is compressed in the carpal tunnel of the wrist, this causes carpal tunnel syndrome. So here it shows the area of compression of the median nerve beneath the transverse carpal ligament. This syndrome includes motor, sensory, vasomotor and tropic symptoms. Talking of the motor changes, firstly there is ape or monkey-like thumb deformity due to wasting of thenar eminence. Then there is loss of the opposition of thumb. So this movement of bringing the thumb close to the little finger is known as opposition of thumb, which is lost in this syndrome. Lastly, lagging behind of the index and the middle finger while making the fist. This is due to the paralysis of first and second lumbricals. Then the sensory changes. So the sensory loss is over the lateral 3.5 digits, and here point to be noted, skin over the thenar eminence is not affected because the palmar cutaneous branch that gives supply to this area arises over the forearm. Then vasomotor changes, it include the skin over the sensory loss, it becomes warmer due to arteriolar dilation and also drier due to absence of sweating. Tropic changes include the skin becomes dry and scaly and also the nails get easily cracked. So this was when the median nerve is damaged in the carpal tunnel. Now if this nerve is injured above the elbow, as in the case of supracondylar fracture of humerus, following features are seen. Now, if this nerve is injured, motor changes will include paralysis of all the muscles that are supplied by this nerve. Talking of pronator teres and pronator quadratus muscle paralysis, the forearm will remain in the supine position. Next, paralysis of flexor carpi radialis will cause the hand to remain in adducted position. Then, on paralysis of palmaris longus, there will be weak flexion at wrist. This movement of hand is known as flexion. Now, remember this thing, the palmaris longus muscle is inserted over the palmar aponeurosis of hand. So when this tendon will get contracted, it will cause flexion of wrist. Now, on paralysis of this muscle, there will be weak flexion at wrist. Now coming to the paralysis of FPL and lateral half of FTP. So this is the flexor pollicis longus muscle whose tendon is inserted over the palmar surface of base of distal phalanx of thumb, whose contraction will cause the bending of distal phalanx of thumb. This is the flexor digitorum profundus whose tendons are inserted over the distal phalanges of rest of the four fingers. On paralysis of these two muscles, that is FPL and lateral half of FTP, the patient will be unable to bend the terminal phalanx of thumb and the index finger when the proximal phalanges are kept firm by the clinician. Coming to paralysis of flexor digitorum superficialis muscle, so you can see its tendon are inserted over the middle phalanges of these four fingers, contraction of which will cause the flexion at the interphalangeal joints. In case this muscle is paralyzed, the flexion at interphalangeal joints of index and the middle finger will be lost. So this was all about the median nerve. Thanks for watching.